All right, welcome back, everybody. Thank you for joining me again. My name is Fitz, the acupuncture physician, and today I'm going to go over a Chinese medicine diagnosis or pattern. And today we're going to go over blood stasis in the stomach, and I'm going to show you how to, as a practitioner or as a student in clinic, how to basically diagnose a patient that has blood stasis in the stomach and what to look for. All right, and what to look for. Again, before I begin, this is for educational purposes only. This is definitely meant for acupuncture students or practitioners. But if you're not a student or practitioner, feel free to listen, but do not try these at home. Do not try to self-diagnose. Always check with your local acupuncturist or medical doctor for any health information. All right. So blood stasis in the stomach. What are the indications for blood stasis in the stomach? All right. So the patient is going to have severe stabbing epigastric pain that may be worse at night. This epigastric pain may be worse at night, and if you press it or push on it, it's going to feel worse, right? That's how you know it's an excess condition, right? So if a patient has abdominal pain, gastric pain, and if you press on it and it gets worse, that's an excess condition. If you was to press on it and it doesn't get worse, then that's a deficiency pattern, right? So automatically we know it's excess, all right? Patient might feel nausea, might have some vomiting, a possible blood. They might vomit blood, or they might vomit or food looking like coffee grains. So those are the indications for a patient that has blood stasis in the stomach, right? So as a treatment principle, as an acupuncturist, what you want to do is you want to move the blood and nourish the blood. You want to move the blood and nourish the blood. The pulse is going to be wiry. Why? Because blood stasis usually comes with a wiry pulse. Especially when it comes to pain. The points now, when it comes to uh, the points to use for this type of condition, it's going to vary by acupuncturist. But I'm gonna show you some points right now that's used for blood stasis in the stomach. Of course, you don't have to use all of them. You could use some of them, or you could add more. But this is the general points right here. Okay, so the points are stomach 34, stomach 21, stomach 19, kidney 21, Sanjiao 6, spleen 4, PC 6, gallbladder 34, Ren 12, stomach 40, bladder 17, spleen 10, and Ren 11. Again, you could add more points or take away more points, but generally these type of points are great for patients that has been diagnosed with blood stasis in the stomach. All right. When it comes to the type of formula we use for this pattern, again, that can vary also. It really can. But when you choose the formula, just make sure you choose one that actually benefits the patient. So formula like Shishang San, that'd be good. Dan Shen Yun, the formula is also good for blood stasis in the stomach. All right. Jisa Zhu Yu Tang. Now, Jisa Zhu Yu Tang, this formula is good for, you can say, pain, in the middle lower jaw, right? You can say below the diaphragm. So that's good for that type of pain, or stasis, I should say, or blood stasis. All right. And then you can use, Tong Yu Tong. But I just wanted to focus exactly on, blood stasis in the stomach, the indications for that. And also, the patient is going to have a wiry pulse. The tongue is going to be purplish. The tongue is going to be purplish. All right. And like I said, the points you could use for a patient like this are stomach 34, stomach 21, stomach 19, kidney 21, Sanjiao 6, spleen 4, PC 6, gallbladder 34, Ren 12, stomach 40, bladder 17, spleen 10, and Ren 11. All right. So if you have any questions, please leave it below. And also, Don't forget to subscribe and like the video, and look out for my next video on traditional Chinese medicine.